And good evening, everyone. Thanks for watching. I'm Scott McGee. Welcome to our coronavirus special. We've been doing these for a few weeks now, and we are here every weeknight with an expert to help answer your many questions during this rather challenging time right now. So you can email your questions or you can message us on Facebook. We are open for business. But first, we want to take a look at just some of the latest numbers for the Hudson Valley. So right now, Westchester is reporting some 9,326 cases. Rockland County up now to 2,511 cases. Orange County at 1,435. Dutchess County 392. Putnam at 167 and 205 cases in Ulster. Those numbers are going up fairly quickly right now. Now, tonight we do have Dr. Tanya Dempsey. She is our guest. She is the founder of Armonk Integrative Medicine, which focuses on combining primary care treatments with integrative medicine. So, Dr. Dempsey, first off, thank you for joining us.
Thank you for having me.
Absolutely. Now, so your specialty may not be as familiar as, say, a urologist or an oncologist, a surgeon. How would you use your skills in a situation like we are facing right now?
My patient population, I'm taking care of complex chronic disease patients. They have multi-systemic problems. Every part of their body is potentially affected. Their immune system is primarily affected. And so in these days when we're really worried about this virus, my patients in particular are in high alert because they have immune dysregulation that could in fact make them at higher risk.
So what would you say, actually, with that in mind, what would you say to people maybe who aren't in your realm, or just sort of average folks, maybe have one thing that, maybe they're slightly high blood pressure or, whatever it is, and all of a sudden they're feeling the stress, I think, that we're all feeling right now, and they're very attuned to their body and they're wondering, oh, what's this? Oh, what's that? What do you say to those folks that are just, sort of the stress? You're not sure if it's stress or if it's something else and you just don't know what to do?
Yeah, it's a great question because there's no question that everybody is on high alert. Their nervous systems are on fire. Everybody is reacting. And so it's sometimes hard to distinguish some of the subtle symptoms of coronavirus, COVID-19, versus stress and other things that could happen. I mean, it's not just, you can't just get that. You can get other things, other diseases, other infections. So it is difficult. What I say to patients, what I say to my patients, and I'll say to, the viewers is that, listen to your bodies. If you're worried, talk to somebody, call your doctor. Don't run to urgent care or the ER unless you really can't breathe. Okay, we need to reserve that for the really acute cases. But if your heart is racing a little bit, you're not sure, or you have a little cough or a little sore throat, you want to talk to somebody, reach out to your doctor, reach out to someone who can talk you through this and tell you what to do to follow the symptoms to make sure that they don't get worse and to make sure that they really aren't something more serious.
And how important would you say is, we're all trying to exercise the social distancing, stay in our house as much as possible. How important is it, though, to get outside, take the dog for a walk, do something in the fresh air so you don't have cabin fever?
Yeah, no, I think you really have to look out for yourself. It's about self-care right now because you can't help it unless you could watch TV all day. You can read the news and you can watch the news and it's unfolding in front of you and it's so stressful. So you've got to walk away from it. So whether it's going outside and taking the dog for a walk or going for a walk or just taking some time to do some deep breathing, I really think that everybody needs to just take a moment for themselves, shut all the distractions off and really just, get their body calmed down and in a different state. It's amazing what like a minute of deep breathing will do for you.
I got to say, I've been a real believer in just a few minutes of meditation just to kind of get that body centered. Just take your mind off of it for just a couple of minutes.
Exactly.
Okay, so I did hear something today, and I'm curious on your take on this. Not long ago, the medical community was telling the general public, don't bother wearing a mask. Now I'm hearing more doctors say, yes, we should perhaps wear a mask. Where do you stand on wearing masks right now?
Yeah, well, unfortunately, we don't have enough masks, or we didn't have enough masks for a while. Now there are makeshift masks. I know people are sewing them, and there are some shipments coming in. But the reality is, yes, everyone should have been able to get a mask. Everyone should wear a mask. The doctors, the nurses, the hospital staff, everyone should be protected because there is some capacity for this virus to be airborne. So the better we can protect ourselves, the better the outcome is. Probably more important even though than the masks. So if you have a mask at home, great, but don't hoard the masks. Give whatever you have extra to the hospitals that need it. But more important than that is the hand washing and the touching of the face. That is critical. If you can wash your hands and avoid touching your face and practice not touching your face, that will take you further than even wearing a mask.
I feel very guilty when I do touch my face. I have to be honest with you. I try not to, and I have varying degrees of success with not touching my face. All right, so let's talk about, we hear a lot of officials telling us there's going to be this surge in cases in a few weeks. Yeah. As we wait for that peak, what's the one thing we need to keep in perspective?
Yeah, we will get through this. We have a lot of resources. We have a lot of good people doing research and trying to get the answers and trying to get the treatment out there. So I am optimistic. I think that we're going to get closer. We have to get through this time. You have to take care of yourself. The more stressed you are, the lower your immune system is, and the more likely you are to get sick and to get very sick. So take care. Again, this goes back to take care of yourself, reduce the stress, minimize your exposures the best you can, and just know that we will get through this. But my heart breaks for families that are losing loved ones because of this. This is beyond words. Mm-hmm.
We just learned tonight that a very well-known neurosurgeon from our area, well known for separating babies who were conjoined twins, lost him, a doctor at Montefiore. And we know that we've lost nurses. There's been so many people in the medical area who are, from what we could tell, relatively healthy, who have already passed. And so what does that tell you, and what should we be telling each other about the fact that there was this thought that just older people, just people with, weakened immune systems are really at risk?
Yeah. And, unfortunately, we did a big disservice by sort of, advertising this virus as really only attacking the old and only being like the flu. And unfortunately, it's so far from that. We are seeing young people, we are seeing people without known medical illnesses get sick, succumb to this virus. So it's clear that there's something else going on. And that's really where the research has to go. We need to understand better what is the person's susceptibility, why some people are getting so sick, and why some people are able to fight it off. Because I have patients who I'm sure have had it. I've talked to them. We can't get them tested, and they've really breezed through it. And I say breezed through it. It was a rough 2 weeks, but they didn't get hospitalized. They didn't have trouble breathing. And what is different from those patients from the ones that wind up in the hospital intubated? And we don't understand that yet. And that's the frustrating part.
Mm-hmm. So now that we've learned this virus can strike a few different areas of our body, like the lungs, the GI system, maybe your kidneys, are there ways that we can strengthen our bodies in those areas? That's one of our Facebook questions we've gotten in.
Yeah. Look, my background is integrative medicine, so I am always looking at other ways to boost the immune system and to help our bodies fight. So I'm an optimist, and I would hope that we'd be able to use some tools to do that. But the reality is, and this is the unfortunate part, is that none of us have immunity to this virus. So it's much harder to boost our immunity in general when we haven't seen this before, compared to, let's say, boosting immunity to avoid getting the flu or getting a cold. But having said that, again, I think it's really important for people to reduce their stress, to take some time to breathe, to eat healthy. One of the things that I'm hearing all the time from my patients is that they're stress eating because they're eating the carbs. Everyone is stocked up on these shelf-stable foods that are really junk, okay? And that's not helping the immune system. Sugar and carbohydrates actually lowers the immune system, makes you more susceptible to viruses and infections. And so the healthier you can be eating whole foods and eating good quality proteins and fats will only help. The problem is, unfortunately, I realize it is much harder to get the fresh food right now. But trying not to get into the junk food and snacking at night to relieve the stress, I think would be very helpful. And beyond that, so that will help the GI tract, that will help your immune system. There are some supplements that we talk about. I don't know if they're right for everybody. So I don't want to necessarily advertise that here, because I really like to personalize the regimens and make sure that they're right for everybody. But they can certainly talk to their doctor and ask, what things can they take to maybe prevent this
I got to
from
admit,
hitting them.
guilty as charged a little bit on the comfort food. I think we all, because actually that goes right. My next question, another Facebook question, which is, we're trying to stock up, and so we want to go to the supermarket, but it's just stressful. We're trying to keep the number of shopping visits to the supermarket down as much as possible. Is there a way we can shop safely?
Yeah, there are some supermarkets out there that I've been hearing about. They're really doing a great job keeping things clean, keeping people, entering the store in one by one, as opposed to a crowd going into the store to prevent the overcrowding and keeping that separation, right? So there are some stores who are really, really, I think most of them now, most of the supermarkets are really in tune to that. They're wearing gloves and masks. If you have a mask at home, or if you have even something made out of cloth, you want to cover your mouth just in case, I would wear gloves, because again, the surfaces seem to be a big issue. And if you don't know if you're going to touch something and accidentally touch your face or rub your eye or something, gloves would be great, but you might have to change them a few times because I know people who put the gloves on and then touch their face with the gloves. So then that doesn't accomplish anything. I think if you did that and you went during the hours when it wasn't that crowded, and you don't go that often, I think it's fairly safe to do that.
Good advice. And I have to admit, I usually grab the items in the back, assuming because people aren't touching the ones in the back. But that's just me. Anyway, okay.
I have to admit, I've done that too. So
yes. All right. Good. Okay. Well, Dr. Tanya Dempsey, we got to take a quick break, but you know what? We'll be right back with more of your questions. Welcome back to our coronavirus special. I am joined by Dr. Tanya Dempsey, an internist. And Dr. Dempsey, I wanted to ask you about testing. There's been a lot of talk about whether there's testing available for people. There's been a lot of frustration. What's been your experience for you trying to get testing for your patients?
So, everything seems to change week to week, day to day even. So initially, early on, a few weeks ago, we were able to get testing. I'm on staff at Greenwich Hospital, so I was able to send patients there with the right forms filled out. They were able to get tested. They set up a sort of like a tent area in their parking garage. So that was relatively easy. I think they started changing things as the numbers started coming in. I don't think they could accommodate as many. Then there were these drive-throughs that opened up. So initially I was able to send patients to some of the drive-throughs, and that's been working out okay. The issue is that the wait time on the phone, the patients have to call basically the New York State Health Department, and they wait a long time and they wait for a phone call back. But generally, if the patients have patience for that, I've been able to get some patients tested that way. Other patients who have sort of taken it upon themselves to try to see other doctors and go to urgent care have had a much harder time getting the testing done. What I understand right now is that like Quest Labs, LabCorp, some of the major commercial labs are running the tests as long as someone sends the swabs to them. So if the doctors are willing to do the testing, they could send it to Quest. So we don't need the test kits anymore. What I'm finding is that a lot of doctors are pushing back on the testing. I don't know the reasoning behind that. I think that some of the patients maybe are at lower risk and they're worried about, overdoing it with the testing because maybe those test labs, Quest and LabCorp, may not be able to accommodate it anymore. But I think that ideally, in an ideal world, I'd love to test everybody because I really think we need to understand who has had it and who is going to be safe from getting it again. And I think that this is really critical. So I hope things are going to change with time.
Is that not the key to sort of loosening the belt on these restrictions a little bit, is if we know who has it, who's had it, so that people could go back to work, because so many people have now lost their jobs because no one can leave the house?
Right. Right, exactly. No, I think this is critical for the economy for lots of reasons. Once we get the antibody testing more readily available. So just to backtrack, if my patients are having acute symptoms, the testing we're doing is an antigen testing. Like we're swabbing the nose and we're looking for the virus. But what we need to start doing, some patients or some people don't even have really severe symptoms. They may not have any symptoms. And the question is, could they have already had it, right? They may be the asymptomatic carriers. And so once we can readily get antibody testing, a blood test to see if the person has been exposed to this virus and has mounted an attack on it, then that will help us understand really how many people have been exposed, how many people are safe from getting it again potentially, right? That's what we're hoping, and then we can let those people back into the workforce, back into sort of daily life.
And when you see timelines like really until the end of April now from the president, other people are saying maybe the 1st of June, that seems reasonable to you?
Yeah, unfortunately, I think we're in this for the long haul. Again, I'm an optimist, and we're going to get there, and we're going to get past this. But I think we have to be realistic. I'd rather be realistic and be surprised when things happen faster and we can get going and back to our lives sooner. But better to prepare for the worst, right? And then if you get better, then that's relief, right?
It is better, yes, to under promise and over perform is always the better way to go. So let's talk about the flu vaccine very quickly. Is that still viable at this point now that we're basically in April? Is that something that could provide some protection?
This is a little bit of a mixed bag. Initially, there was a big push to get the flu vaccine with the thought that if you got the vaccine, you lower your chances of getting the flu. And so if you got COVID-19, it would be a little more clear, right? It wouldn't be so messy and hard to understand if it was really the flu or that. So there was a big push for that. There's a study that just recently came out. It's a small study, but it's suggesting, and again, I can't go based on one study, but it's suggesting that the flu vaccine may actually be making people more susceptible to this virus. Again, I'm cautious about going by that, but at this point, I'd rather not people start getting vaccines for the flu because it lowers the immune system, generally speaking. We know that for 2 weeks after getting the flu vaccine, the immune system has to build up antibodies to the flu. So that's how it protects us. So right now would not be a great time to do it because we don't know what it will do to the immune system and whether it really will make people more susceptible to the virus. So I'm just cautious right now with that.
That's a good point. I have never heard anyone say that actually so far, and I've been talking to a lot of doctors, so I'm glad that you put that out there. Obviously, that's something we're going to need some more science to try to get our heads around that one. One more question related to that, though, and there has been some talk about sort of the seasonality of this, and that may not be so pronounced now because people go from Australia to here, where in the past, in the summer, typically the flu goes away, but now it's going to be winter in the southern hemisphere and there's some movement that way. Do you expect this coronavirus to taper off in the summer and then come back in some way in the fall?
We don't know enough about this virus yet to understand how the seasons and the heat and humidity are really going to affect it. A lot of people are saying, hopefully as it gets warm, it will, the numbers will go down. It won't go to zero. And maybe we'll get a resurgence in the fall. We don't know. I mean, I will tell you that in the last few years, I've seen more flu in the summer than I've ever seen before. So, I used to feel pretty confident that if someone got sick in the summer, that it wasn't the flu. But we've had confirmed cases of the flu now in the summer. And that's exactly the reason what you said is that people are traveling all over the place and being exposed. And so the seasonality doesn't hold as much as it used to.
All right, Dr. Dempsey, we got to take a quick break, but you know what? We're going to be right back with more questions for the doctor. And welcome back to our coronavirus special. I'm joined by the founder of Armonk Integrative Medicine, Dr. Tanya Dempsey. Dr. Dempsey, thank you for joining us once again. What do you have to say, or what thoughts do you have for anybody, as we just have this short amount of time here, for your main concerns about the coronavirus and what you want people to know?
Primarily, what I'm seeing, at least in the patients that I'm talking to, is that a lot of patients are starting to notice symptoms. There's a lot of fear, obviously, because we're seeing the worst case scenario. And what I want people to know is that if you've had some symptoms and you're getting through it, think of the bright side of that, right? That you might have the antibodies, you might be protected, and you've gone through this. So I want to reassure people who are starting to have symptoms or have had symptoms that more likely than not, they're going to move through this and they're going to be okay. Not to think of the worst case scenario. Having said that, to be cautious and aware that could happen. Just be on alert, and communicate with your doctors if you're worried. But I think it's important for people to understand that at this point, many people have been exposed, and so people have started asking me, the kids have been home for a couple of weeks already. Do you think it's okay if no one's had any symptoms? Do you think we're free and clear? And can we start, like getting together with friends if they've been free and clear? We have holidays coming up. People are thinking of those things. I'm still really leery about that. I'm really concerned about the incubation of this virus, which could be a lot longer than we think. It could be 14 days or it could be longer. There were some studies that showed it could be up to 16 days, even though it's usually less. So I just want people to be cautious. Just because people haven't had symptoms doesn't mean that they're not a carrier.
I'm sorry I got to break in, but